This from Catherine Watt, March 17th, 2024. Department of Justice. Fraud and resulting death injury from COVID shots are part of the U.S. public health policy. It goes like this. I suggest you all reread this a few times to truly grasp the depth of the depravity outlined in the argument by the DOJ. They are stating that they know that pharmaceutical fraud has been committed and the deaths and injuries resulted from it. They are also stating that mass death and injury are in fact fully known to the pharmaceutical regulators and that no corrective action is required because this is consistent with the United States of America's public health policy. Let that sink in, friends. Doc,
wow.
Your comments. This is democide, and no wonder the CDC and the FDA continue to push the bioweapon masquerading as a vaccine.
You can no longer trust the medical system. You can no longer trust the hospital system. You cannot trust. You have to trust and verify. You have to know your farmer better than your doctor. And you better know your doctor because they're working on limited knowledge that can affect your health, and to not take responsibility for injury. You know, I mean, how many times have they arrested me, Sean, for doing what? Educating, telling people, you know, how to make changes in their own body, which is a non-medical. It's a healing approach, a natural approach, a God-given approach. These so-called experts are not experts. They get paid tens of thousands of dollars to be experts to say what they're told to say. And it has nothing to do with your well-being or improving the quality and quantity of your life, because that is not the agenda. And we can no longer trust Big Pharma. We can no longer trust the medical mafia. We can no longer trust our indoctrinated doctors. I mean, I was blessed with a family that taught us to learn to care for ourselves. We do not run to the hospital. We do not run to doctors. And what we do is we resolve this ourselves. Isn't that what they did in the 18th and 19th century? Not the case in the 20th century when the Rockefellers took over and the Rothschilds. Well, they'd been around for a long time. But modern day medicine, in the beginning in the 30s of antibiotics, what does anti mean? Against, biotic, life. I mean, is that a clue? They warned you what it is. Why would you ever take it? The key to health is managing the internal environment, not treating any specific diseases. Why? Because there are no specific diseases. And you're not sick, you've been poisoned. And the quality and quantity of your life is being affected. And we have tested a lot of these nutraceuticals and a lot of these pharmaceuticals that are being used to treat specific diseases. They are literally tainted with nanotechnology. And now what we're doing is we're doing pilot studies and we're doing more comprehensive studies, randomized placebo studies, international, with third-party testing, because I can say what I say. But if I'm blinded from that, I want somebody else to validate what I've already said, because we've published on this. Graphene oxide is a published, study. It's called the non-disclosed ingredients in the COVID-19 vaccines. And I disclose in their research using STEM microscopy. Yes, some microscopy and nanomicroscopy, but also spectroscopy to identify specifically the ingredients that are contained, and they are all contaminated. I don't care what they call it. All vaccines prove, if you survive them, is that you have been poisoned and have survived because of it, and the body is reacted to any foreign material. You cannot put foreign matter from human or animal into another human without an immediate reaction and rejection of that. The defense is to neutralize, chelate, and remove it immediately before it kills you.
Yep.
That is not providing immunity. And it's very important that you listen to me, who's ever listening. Immunity is not found by granulocytes and agranulocytes. We're talking about the white blood cells, not by neutrophils and not by lymphocytes. That's where education needs to begin. There's an organ in your body that provides homeostasis, that provides and manages and maintains the alkaline design of all your body fluids. And it's not the white blood cells. They support, but it's not the major organ. The major organ that manages and maintains the alkaline design at a pH of the blood at 7.365, in the interstitial fluid at 8.4 or 8.365, 10 times greater pH behind the veil, that vascular wall, from 7.365 to 8.365, 10 times greater. And then what is the organ that maintains that? Because when you feel stress in your muscles because you overlifted when you went to work out, or you ran a marathon, and you see at the shock point, on the 22nd where people hit the wall, they're on the side of the wall, many of them throwing up. What are they throwing up? They're throwing up acid. Why are they throwing up acid? Why hasn't anyone answered that question? I'm going to answer it for you today. When you see a mother who's in her first trimester throwing up, when you see a runner or an athlete throwing up, that is the body throwing out hydrochloric acid, which is a byproduct of what the stomach does, which it produces baking soda. Yes, folks, sodium bicarbonate. The same stuff when you go to the emergency room and they hook you up to an IV of 0.9% saline. Many times they'll put in an 8.4, solution of sodium bicarbonate because that's its pH. And to restore health and life, you have to maintain these delicate pH balances and what they call the zeta potential, the electrical potential. And that's what Force Salts does. That's what MasterPeace does. That's what Master Results, because they're all geared towards 8.4 at identical to what the pH is of the interstitial fluid. What to do? To stop cellular breakdown, to stop the corona effect, to stop the spike protein effect, to stop the activation of the lymphatic system. What does the lymphatic system do? To neutralize oxidants. This has been my life for 40 years, and this is what these bad actors, these demons, want to stop, because what it does, it puts you in the power seat to manage and maintain your own personal health and determine your quality and quantity. You don't die at 65 or at 75. You actually do that with your lifestyle choices. What you eat, what you drink, what you breathe, what you think, what you feel, what you believe.